Congressman Peter Roskam, a Republican of Illinois, joins you right now. He attended this White House healthcare summit. I remember that well, Congressman, and many are now saying, I was reading this page one story in the Sunday New York Times that was among the many seminal events that helped President Obama, that it looked like he was trying to reach out to you guys, and away we went. What do you think of that?
Well, look, I mean, I think at the end, when it really came down to it, the only thing that's come of this that's bipartisan is bipartisan opposition, Neil. You don't really get the sense that all the Democrats are singing off the same song sheet. You do get the sense that they're likely to pass this tonight based on the compromise that some of the pro-life Democrats made. But I don't get this gleeful feeling on the part of Democrats that they're anxious to campaign on this, particularly coming this fall. Look, think about what just came out in Illinois. News that Caterpillar said that this is going to cost Caterpillar alone $100 million next year. And now that's in a swing state with 11% unemployment. And I think these types of stories that are going to be continuing to come out, as you mentioned, we're going to be talking about this tomorrow. We're going to be talking about this all through the Senate process. I think it's going to be a lot tougher of a sled for Democrats to keep pitching this as this fabulous idea that's going to be so revelatory for so many Americans. I think they have overpromised like they did on the stimulus, and they're going to be under-delivering like they did on the stimulus.
But they argue that a lot of the stuff that's going to be the promising stuff will be the fulfilling stuff almost immediately, the good stuff. In other words, some of the nastier details, like taxes and plan and premium increases that could come in short order, might not be in short order enough by November when you have the midterm elections, and that this hoped-for route that you Republicans are envisioning doesn't materialize, or at least not to the degree you thought. What do you think of that?
Think about this, though. If you're somebody who has an expectation, and you've been listening all night to these declarative statements about what's going to be happening, and you're somebody who's having an expectation that you're going to get health coverage under this, and you find out that you're going to get dumped onto a welfare roll, that is, you're literally going to be put onto Medicaid, and Medicaid is a program that doesn't have physicians anxious to take more patients. It's a process that is undercompensating physicians, and all of a sudden you're told, hey, good news, you're on welfare. That's actually the predicate upon which 15 million Americans under this plan are going to be served. That's a failure. That's, again, overpromising. It's like giving somebody a library card and telling them, good news, you get to go to the library, and you go in, and there's no books. And so I think that this is an example where this flourishing rhetoric and all of these wonderful declarations that we've heard all day, they have this crashing sense, I think, on the part of the American public. And when push comes to shove, I think folks are going to be looking and saying, why are my physicians reluctant about this? The Illinois State Medical Society, a big state, has said, we're not into this at all. They've rejected this approach.
Well, you might be right on all of the above, Congressman, but I take exception, sir, with the way you think this has been framed for the American public. I think, if anything, the American public has been taught to think that this is going to be a total disaster and that everything they know will end, and that if they don't see that, they might just say, well, this isn't as awful as I thought. It might be just the opposite, right? At least near term.
Well, look at this. Think about what happens tomorrow when the conversation in Illinois is about Caterpillar in particular. Caterpillar says, we're going to, because of this government mandate, because of this mischief tonight in Washington, D.C., we as a corporation are going to have to spend $100 million on this nonsense, and it's not something that we're going to be able to use for job creation or R&D or development or any of these other things. I think the ripple effect of that, Neil, is going to be very, very significant. And I think ultimately the proof is going to be in the pudding. Look, people are going to choose in November, and I think the American public has said enough of this nonsense. They're not into it, and they want to see us start over.
All right, Congressman. We say, by the way, any good guess you're getting on when you guys are going to vote?
Listen, your guess is as good as mine. You're paid to know what's going on.
Well, actually, you're there, and I'm not.
I know. It'll be within the next couple of hours.
Next couple hours. Well, that's reassuring. All right, Congressman, thank you very much. Seriously, very good having you on.